Good afternoon and welcome to another edition of the WARF Essential Topics series. My name is Laura Heisler and I'm Director of Programming for the Wisconsin Alumni Research Foundation, and we are delighted to bring you this series from time to time on issues and topics that are important to members of the UW-Madison and Madison communities and broader communities when it comes to understanding technology commercialization. Today's session is going to be a little bit different than our normal one because we have two major things we're going to accomplish. We're going to be talking about stories of innovation across that whole hour. And the first portion, about the first 35 minutes, will be a more typical session and a conversation led by my colleague, Jennifer Gottwald, Director of Licensing at Wharf, and some inventors and entrepreneurs. And a little bit more than halfway through, we're going to transition and hear from Chief Intellectual Property and Licensing Officer, Michael Falk, about the WARF Innovation Awards and meet this year's WARF Innovation Awards winners. So we have a two-part thing to round out the year. Just a couple more notes. We are recording this session. You'll be able to find the video at warf.org tomorrow. And we certainly do want to field your questions, as we always do at WARF Essential Topics. We'll be fielding them as part of the first portion, and we'll be rounding that out and finishing that up at about 35 minutes after the hour. So I'll send out a little reminder to you that you can ask your questions at any time during that first portion of today's session. We field your questions using the Q&A function, which you can find by mousing over your tool tab. And you can ask your question at any time and we'll do our best to get to it. So with that, I'm going to move things along and turn the podium over to my colleague, Jennifer Gottwald, Director of Licensing at Wharf, to moderate the first portion of today's session. Jennifer, over to you.
Thanks so much, Laura. Welcome, everybody. I'm really excited to have this conversation here today. You might have been sat in on a WARF Essential Topics last month where my colleague Beth Werner talked to Professor Jenny Gumpers about patenting inventions, kind of the nuts and bolts of how to disclose your invention to WARF and what we do with it. And then Jenny talked about her experience. Jenny is one of the WARF Innovation Award finalists, as are my guests today. We have Professor David Plante and Professor Reid, Alisch, along with Matt Berg, who's the CEO and co-founder of Somni. I'll get more to them in a moment, and we're going to talk about how these other Innovation Award finalists are already collaborating with a company that we hope can bring their product to the market after some years of development here. So with that, I am going to play a short video where David and Reid are going to explain their technology and what they want to do with it.
Hi, I'm Jennifer Gottwald, a licensing director at Wharf.
And I'm IP Manager Victoria Sutton. For the 2020 WARF Innovation Awards, we're pleased to nominate Drs. David Plante and Reid Alisch for their work to better understand and quantify sleep.
In collaboration with the company partner, the test they are developing would be the first of its kind. It could not only help to identify and treat sleep disorders, it could also be used for occupational safety and to promote healthy lifestyles.
Congratulations, David and Reid. We're excited to see you take this technology to the next level.
Hi, I'm David Plante. I'm an assistant professor in the Department of Psychiatry, and I'm the medical director at Wisconsin Sleep. Sleep is a really important aspect of all of our lives. We spend about a third of our lives sleeping, and it plays a key role in our overall health. One of the challenges in studying sleep is the ability to measure it. And usually we have to rely on very complicated and expensive laboratory tests that use brainwave activity to measure whether or not someone is asleep. So what this technology fundamentally does is it tries to use an easily accessible sample, saliva, to estimate the amount of sleep people are getting at night and also how sleepy they are during the day, and to do so using changes in genetic expression.
We start with saliva and we extract DNA to monitor an epigenetic modification that is found on the DNA. This epigenetic modification is variable and it's related to the amount of sleep that a person needs. We have a real opportunity here to take an accessible tissue and very quickly determine the level of sleep that an individual needs or the level of sleep that that individual has been getting. And we can relate this to the health outcomes of that individual.
So we're very excited about further advancing this technology because it has really immense implications for a lot of different industries. So being able to identify how much sleep someone is getting or how much sleep they need has a lot of very practical implications, both for healthcare, because sleep is such an important part of our overall health, and also occupational settings, where knowing how much sleep someone is getting before they operate a motor vehicle or an airplane, for example, is really key to keeping everyone safe. Really, my hope for this technology is that it will be a game changer in the practice of sleep medicine. I'm a sleep medicine physician, and I really think that it's important for us to try to advance our field to care for what is really an unmet need in our overall health and healthcare. So I think having this technology that would be widely available and easy to use, it really could make caring for patients, both in the sleep clinic and then in other settings, much better.
Excellent, thanks. It's a fun experience to see yourself on a video while you're on Zoom, isn't it? So congratulations to Reid and David for being finalists in the WARF Innovation Awards. You'll hear about the other 4 finalists after our discussion here. So I'll just kick this off a little bit. David, you talked a bit in this video about current measurements of sleep. It seems like a very simple thing, but that it's really kind of cumbersome, doesn't always give you the best results, is expensive. Can you just tell us a little bit about how you currently do these measurements in the sleep clinic or as a physician, and what we need to make these better?
Sure. So we have a lot of different ways to measure sleep. So the easiest way is just to go out and ask somebody, how much sleep did you get last night, or do you get on average? The problem is that estimate is usually pretty inaccurate. So people aren't very good at estimating their sleep, and it's not for sake of trying, but I think it's really challenging because you're asking people to sort of measure an activity when they're unconscious. So they're not really aware of what's going on anyway. So it's oftentimes a little bit off. And then in the clinical setting, we have a couple of different ways to try to measure or estimate sleep. So one is with something called Actigraphy that uses accelerometry. So it's got something that's similar to what might be in your Fitbit that measures rest activity patterns. The problem with that too is it doesn't really measure sleep. What it does is it measures whether you're moving or not. And so it doesn't really give us an accurate enough window a lot of the times to understand how much sleep people, again, are really getting. And the best way, the most accurate way to measure someone's sleep is to put them in the sleep lab, where we put a lot of monitors on them, measuring brain waves and other monitors. And we basically estimate how much they sleep using gold standard technologies. The problem is it's very, very expensive, and it's also not a typical night for people. So we've got all these sensors on them. They usually don't sleep all that well. And oftentimes we can't let people sleep longer than they normally do in the lab because it's complicated with changes of shift and technicians and those kinds of things. So actually estimating the amount of sleep people are getting accurately and using a simple measure is a real challenge clinically.
That's great. Okay, so you wanted to find a better way to measure sleep, and Reid, you work on various things about markers, biomarkers within the human body. Can you explain how you got connected to David in this project and what you were trying to do with it?
Sure. So my group is really focused on finding objective molecular markers for human health. And when I met with David, he told me about the problem that he was experiencing in terms of this more subjective measurement. He also told me that he had a really unique group of individuals that were unmedicated and had unexplained hypersomnolence, meaning their amount of sleep that they would need was much greater than the average person. He told me about this great need for trying to determine the sleep need and the sleep that people were getting. And we felt that together we had a real opportunity here to identify a more objective marker of sleep and sleep duration.
Great, thank you. So you both came to Wharf and you told us about your invention. You found some epigenetic markers of sleep, as you explained in the video. And at that point, we're going to introduce Matt Berg here. So Matt, can you tell us a little bit about your company, Somni, and how you became aware of Reid and David's work?
Yeah, and thanks for putting this on, Jennifer, and having us here. Yeah, so the backstory here is one of somewhat serendipity. Our company Somni is a digital health company in Madison, and we're focused on sleep, and specifically making long-term meaningful improvements to folks who are what we would somewhat label as sleep desperate or really struggling to make changes to their sleep. And we've been working on this problem now for several years, and we typically work with organizations to deploy this to their employees. And a longstanding challenge, and just sort of dovetailing off of what David said, is this problem of tracking sleep accurately. And so we typically will use commercially available devices, Apple Watch, Fitbit, things like that. Unfortunately, there's just inherent error in these devices, and you're never really truly getting sort of data that you can rely on always. And for us, it's really not pragmatic to put someone in a lab overnight for what we're doing. And sort of this is a couple years ago, a colleague we used to work for who now is at Wharf remembered actually this problem this challenge, we've been dealing with over the years, and thought to connect us with Reid and David's work. Well, actually, sort of with you first, Jennifer. And so it gave us a chance to look at the research and get to know David and Reid, and it was just sort of like this almost like too perfectly, it was almost too good to be true, sort of falling in our lap, in the sense of like, we have this real challenge in terms of our sort of behavioral health program that we offer, in terms of being able to track someone's progress over time. That's a big component of this, to be able to show that this is working or not. There's a whole bunch of other things we want to do ultimately with the data, but for us to have a more reliable, precise way to track someone's sleep as they go through our behavioral medicine program is very important. And so we couldn't be sort of more thrilled to be able to participate in this work, and that's sort of the origin story, if you will. So I guess it's one of somewhat luck on our part that we stumbled into this, if you will, but we're happy to be at the table, suffice to say. So
great. So, and I know my colleague Lei, who first told me about Somni and introduced me to you, this was very, very, very early on. I think some of you out there who may be Wharf inventors are thinking, well, I disclosed something a couple of years ago, and I don't think companies are interested in it yet. That's pretty normal. Wharf goes through a lot of marketing on technologies, but we're also looking for when your papers are going to publish, and you've presented at a few conferences. You're the experts and lend credibility to your technology. So that's kind of sometimes the impetus we get to start marketing to companies. This was something that Reid and David had just kind of found out about, got the data to the point where they thought we should go talk to Wharf about it. So Matt, I know at first I was a bit maybe frustrating to you in that I couldn't tell you the details until we had filed a patent application and we put you under a confidentiality agreement. I don't remember how long that took, but I know we had some good discussions in there about how Wharf works and what might happen. And you understood that the reason for a bit of delay, but I was super excited that we had a company interested that early. So we got the patent application filed, and then we got a confidentiality agreement in place. And then Matt, I think we set up a big meeting where you could meet David and Reid. So maybe all three of you can just kind of talk about how you started this discussion. Okay, Reid, you're good.
Yeah, I mean, it was, it felt organic. I mean, we didn't know anything about Somni, and we wouldn't probably know anything about Somni if it weren't for Jennifer and Wharf to introduce Matt and his group to us. And, really from the beginning, it was it just made sense. I mean, everything that Matt described were challenges that we were trying to overcome in David's sleep lab as well. And, the data that David and I, have generated, although, in the beginning stages and preliminary, they really suggested that it could help in this situation. So we were really excited about the opportunity of sort of teaming up with a group like Somni and to really test our invention sort of in the open waters, if you will, in a group of individuals that, like I said, David had a really, unique and ideal collection of individuals that allowed us to have the signal to find, epigenetic marks and their sort of their levels of epigenetic marks in relation to sleep. But now we wanted to really test, in a much bigger group of individuals that, not everything's perfectly aligned. And we really wanted to see how well our technology would work. And so Somni and Matt, since day one, they've been really on board with giving it a try and helping us, make that a reality.
Yeah, and I'd also say that there's a lot of patience. I want to thank Matt and also Wharf, for, I can't speak for Reid, but my naivete about the whole process, right? I mean, I'm sort of new to the whole process of disclosing to Wharf and filing patents and those kinds of things, but it's been really nice and it's been, like Reid said, kind of a very organic discussion. We don't always know exactly where we're going with these things. That's part of discovery, I think. So, it's really exciting to be able to have the potential to collect data and samples and collaborate with people outside of academia. I think it's very easy to sort of get, lost in an ivory tower sometimes around the things that we do or invent or study. And so it's really nice to, have a little bit more real world perspective to see if these things, really do, pan out, and where the rubber meets the road, I think is really important. So it's been really helpful, I think, to get those perspectives and also just to learn about sort of how all these things work in the real world. I mean, we're so, I think, into writing grants and doing research that it's very easy to get lost in all of the other work that really goes into something to make it, usable to the broader population and really have a translational impact. So I think it's been great working with Matt and with Wharf on this whole process.
Yeah, and just to share some words on that, I think organic is definitely the sort of the right word, but it also just felt like we're all working towards the same problem and just sort of on slightly different paths. And I think that's why it's felt so, like, how do we bring them into the fold of this, and how do we team up with Reid and David, since from day one it just felt so natural, and they've been fantastic to work with, and Jennifer, you as well. I've interfaced with tech transfer offices before Somni in other capacities, and I have to say that this whole experience has been so smooth and as enjoyable as it can be, in terms of sort of going through the process. It's nothing but good things to say. And particularly I want to emphasize around thinking about long-term partnership, because I think the reality is, and I know, David and Reid and I have sort of touched on this, but this is going to take a while. No matter what happens, there's going to be, as you sort of wander and invent, sort of David, in the discovery process, there's time that happens, and there's, sort of you're swinging the bat and taking shots, and you're not always sure where they're going to land. And so I think from the beginning, there's been this great spirit of long-term partnership, which we so much appreciate here. And I think part of this is it's made it even easier from early. So sort of day one to get involved and say, how do we participate here and help sort of invent the future? I think for us, at least from our perspective, it's so clear how, the next decades coming with, this intersection between sort of genetics, software and health are going to play a huge role in everyone's lives. And to the extent that we can play in that space, to build tool sets that ultimately, improve health and unlock value for our customers, we're thrilled to do that. And I think this tool that Reid and David have created has immense potential for just that. This ability to, there's monitoring applications, but then there's also very practical sort of even edge cases that are even more direct in terms of what this could become from a health standpoint. So there's so much here that we're just scratching the surface. And so I think positioning this and setting this thing up for, I thought about this a lot, in preparation for today is how do we, Jennifer, I think our conversation has been so rooted on setting the foundation for a long-term partnership. Again, just we're so thankful for that and to be partnered with Reid and David on this great effort.
I'll echo that back too, Matt. And I think that's an important thing here at Wharf and our whole process of inventions at universities and moving them out into the marketplace. We know that everything that happens at the university, I mean, by virtue of why we have such great professors and great research, is it's cutting edge, it's brand new. You get the data to convince your peer reviewers that this is something real and can get published. That's not necessarily how things go when they're developed within industry. There's more of a luxury of taking time to get more data and prove more things out. So Wharf understands, and our inventors understand, and our licensees understand that we're entering into something pretty risky early stage. And we're hoping everybody sees long-term potential, and we want that long-term potential to come to fruition. So we need to work together collaboratively, kind of sharing that risk in order to make that happen, which is great. What was surprising, Reid and David? Can you tell us a little bit about if you have worked with industry before or not? And what surprised you about working with Matt, talking to him and meeting other people in Somni and figuring out a collaborative plan for going forward?
Reid, do you want to, I guess I'll go ahead and field that. I mean, so I've worked with industry, but not in this type of capacity. So, I usually the capacity that I've worked with industry or interface with them has been in my role as sort of a physician and sort of some expertise in sleep disorders and sort of providing, consultant type of feedback to companies about either studies that they're developing, those kinds of things, because I have a background in clinical investigation. So my interface with industry has always been on that type of level. It's always been sort of, how can I help them, advance whatever they're doing, but usually on a consultant level. I've never really been involved in this way where it's something that, I'm really invested in, where this is something that I care a great deal about. Like it's the area, it's the patients that I take care of. It's the field that I care about, that I've sort of dedicated my life to trying to sort of help and advance. So it's a lot more exciting for me in that kind of sense. So really having the opportunity to be invested in this particular technology early on and upfront, I think is the biggest difference for me.
Yeah, and I would only add to just the interactions that we've had with Somni and some of their team. And, I don't know if, I think you used the word surprising. I don't know if it was surprising, but it was really eye-opening. It was eye-opening how much, they wanted to learn from us and really about the specifics of sort of the, the molecular specifics. I didn't expect everyone would have known that going in, but they were very sort of thirsty to learn more about it and then to figure out how they could sort of help us. So help us, which in turn helps them. And so that's where the teamwork really, really showed itself to me. Their enthusiasm for our work, I think I remember one of Matt's colleagues saying, wow, this is really cool. And, that was exciting for us to see because of course we think it's really cool, but, for other people who don't think about sort of epigenetics or, genetics in general, or maybe even some of the sleep duration stuff that David's focused on, they found it really fascinating. And I think reflective on how they view themselves and how they view how they would, they would gain something from this technology and actually help themselves personally, and then how it would help in the greater population. So it was really exciting just to see how, in some ways, there were groups, there was colleagues that are on some of these calls that really haven't thought deeply about sort of the molecular component of this. And so for me, that was really exciting to share that with them and see their excitement, and that excitement sort of, it was really great for our meetings in terms of what are the next steps.
Great, thanks. And Matt, I know I was impressed in early looking into Somni that you are, you definitely take a basis in science. And I know when I first spoke to you, and as Reid and David have said, you're interested in the science around the sleep. You want to apply the science best to the products and services that Somni is offering. So can you talk just a little bit about where do you best access that science? What, you know, you've said, and I appreciate that it was a good experience accessing this university and through Wharf in order to see some brand new science that you might be able to add to your products. Can you talk a little bit about why that science is important and how it does add value to your company?
Yeah, you know, so if we zoom out and we look at this from sort of a 30,000 foot level, one of our efforts is to really have an evidence-based program first. And so what we mean by that is when someone comes to Somni and goes through one of our behavioral medicine programs, that we can measure that they've had meaningful change. And so there's a lot of ways you can do that, but at the simplest level is like, are they sleeping more, and is that sleep quality improved? So, and to our sort of efforts in that goal, we try to use best practice sort of research and literature to drive that around sort of turning the different sort of knobs and variables that control sleep that a human has control over. And so that's sort of where we come at it from our lens. But you know when we met Reid and David, sort of this you know, when you meet sort of researchers and scientists as world class as they are, you know, I think what becomes like very clear that you know, being able to sort of utilize some of the great work that they've done and incorporate that into what we're already doing just became a really a no-brainer. And so, you know, going forward, we're going to try, you know, to do, we're going to do it to the best we can, above board science, to try and publish, you know, our findings as we go forward, so, you know, we can share with the world. I know that's something we both have, you know, mutual interest in. But, you know, I think the reasons we come at it are slightly different, but ultimately just to be able to show to people that this does work, and that, you know, you can use it in sort of a predictable and reliable manner. And so, yeah, so I think accessing the science through Wharf has been, you know, we couldn't have done it any other way, no practically sort of feasible way that I can see without Wharf. And so, you know, Wharf's been tremendously helpful in this whole process.
Well, great. That's what we like to do here. We like to connect the great innovations at the university with the world and get them applied in through our industry partners. So I'm going to ask one more question here, and I want to remind the audience you can submit questions through the Q&A. We'll go to an audience question after I just ask what people might be wondering is, okay, so we've got a very early stage technology, a patent application filed, and the roots of a collaboration with a local startup. And I know all of this is very, very, very early right now, and we don't want to make any promises, but when do you think we might hear more about what's coming out of this collaboration?
I'll try and take a stab at that. You know, I'm sure Reid and David have their own perspectives on this. You know, I think we have so much work ahead of us. This feels like very much day one. You know, I kind of go to the quote, it's coming to my head, you know, the best way to sort of predict the future is to invent it. But with oftentimes so many inventions, it's just a winding road. And so I don't want to overpromise. You know, we're in the business of sort of over delivering, under promising is what we like to say. And so I'm gonna probably defer to them. But to suffice to say, I think it's a months, if not years, long road ahead. You know, as soon as we have meaningful sort of information to share, we certainly will share it. But yeah, we have a lot of work ahead of us.
So I think that's a sufficiently vague answer that I would support. No, I mean, really, it's hard to know. There's a lot of things we have to, you know, do to move this forward and really, you know, advance the technology and see what it can and can't do. I would say that, you know, the COVID pandemic has created some challenges for doing clinical research, especially in healthy volunteers. It's very hard to, I think, justify recruiting healthy volunteers in the community to come into sleep lab, to do studies and those kinds of things. But we've been very fortunate that we can continue some of the work that we're doing because we still have patients with clinical sleep disorders that we study in the sleep lab because they need care. And oftentimes, one of the things that's been really exciting is the work that we do often piggybacks on some of our clinical care. So we're actually able to study patients, obviously with their permission, as part of these research studies, which is really exciting. And then also, Reid and I have gotten a grant that's I think it's in the works. I think I can say that's from the American Sleep Medicine Foundation to support some of the research around these issues too, and some of these discoveries. So we're really excited that we're going to be able to hopefully merge different lines of funding, support, and collaboration to really try to move things forward. So all looking bright, although the timetable still is a little bit to be determined.
Go ahead, Reid.
I was only going to add a little bit to that and just say that, aside from the vagueness, which is necessary because we really are at the early stages here, just to give people an idea, it's really the plan is to basically take this for a test ride. And we need to do that in bigger populations. So we are going to spend the next year or 2 or 3 testing how it works in these bigger populations and diverse populations. And we're going to have to refine it, and we're going to have to tweak it, and we're going to continue to sort of reinvent this wheel. But we believe we have real content here, and we believe with this process of testing it in these different populations, we'll be able to refine it into a working model that can be used in the next few years.
That's all great. And I love to, David and Reid, congratulations on the grant. And I think that also shows that working with a company going forward on an invention doesn't preclude your normal academic progress either. And then, the usual research funding opportunities, like David said, that can all kind of converge and add to each other. So we just have a few minutes left. We do have a question from the audience. From both the faculty researcher and industry perspective and your experiences, what ideas do you have to better connect university research with companies looking to solve problems? We said there was a bit of serendipity here in having good networks. That's very important, and that's something we're always trying to do at Wharf, and I'm sure, Matt, as a company, you're always trying to expand your quality network so you're aware of what's up. Do you guys have other ideas of that you could give to your colleagues as to how to better make those connections?
Well, I would just say contact Wharf because it's really hard. I mean, as a researcher, we're focused on, as David said, writing grants, writing papers, keeping our head down and focusing on the challenges that are directly in our either practices or in our laboratories. Wharf is great at helping you to basically extend that opportunity to find prospective collaborators. And so one thing that David and I did is we met with them very early. We had our preliminary data, but we met with them before we had any abstracts out there, before we started writing the paper. And we just wanted to know, what do we do next? And basically they took us by the hand and they led us down the aisle, if you will. So it's been a great experience, but that's the only thing I can think of is I would contact Wharf and let them help you.
That's a wonderful note to end on. And I'll also mention that this question actually came from our colleagues on campus with Discovery to Product, or D2P. Wharf is part of an innovation ecosystem here on the UW-Madison campus and within the whole city of Madison and the county of Dane as well. So there are others who can help you too. We might ask you to go elsewhere. We might introduce you to other people. So come into the ecosystem where you know people, and we'll figure out where you should be to get the best help you can. Laura, did you have a comment?
Nope, nope.
Okay, sorry.
No, not at all.
I misunderstood something. But with that, I want to thank David and Matt and Reid for joining us. And congratulations, David and Reid, on being finalists with the WARF Innovation Awards. And at this point, I'll turn it over to Michael Falk, our Chief IP and Licensing Officer at WARF, who will tell you about the other finalists as well as other honorees in innovation on the UW campus. Thank you.
Fantastic. Thank you. Thank you, team. Thank you, Jennifer. And what a great technology they're working on. Such a nice group of people. That was just a really enjoyable presentation. So thanks a lot for sharing that with us. Before we get to the Innovation Awards today, I'm pleased to be able to share some news about 2 select groups of UW-Madison innovators, including several Wharf inventors. First, we want to repeat the good news announced late last month that 6 UW-Madison faculty have been recognized as new fellows in the American Academy for the Advancement of Science. They are Laura Albert. She's a professor of industrial and systems engineering, nominated for distinguished contributions to the application of operations research methodologies to public policy, and for communicating her research to the public. Second up is Alta Chero, Warren P. Knowles Professor of Law and Bioethics, for her influential work on bioethics and public policy, including outstanding scholarship incorporating ideas and research from philosophy, law, biology, and the social and behavioral sciences. Next up is Patricia Kiley, Professor and Chair of Biomolecular Chemistry, for distinguished contributions to understanding mechanisms that regulate E. coli's life strategy in different oxygen environments, specifically how transcription factors exploit iron sulfur metal centers for oxygen responses. Bill Resnikoff, William Resnikoff, Emeritus Professor, now at Marine Biological Laboratory. He's the Evelyn Mercer Professor of Biochemistry and nominated for deciphering the molecular details of transposition by studying a model bacteria, transposon. William Tracy, Professor of Agronomy, and Cliff Barr, an Organic Valley Chair in Plant Breeding for Organic Agriculture, for his role as a national leader in plant breeding and germplasm, and for training a generation of breeders while also communicating breeding's importance to the public. And finally in this list is Ellen Zweigel. She is the W.L. Krasser Professor of Astronomy and Physics for distinguished contributions to quantify the role of magnetic fields in shaping the cosmos on all scales. Congratulations to these remarkable scientists. WARF is especially proud to manage the inventions of Professors Kiley, Tracy, and Resnikoff, with the goal of applying their research results in the real world. It is also my pleasure to be able to announce that 3 UW-Madison faculty have been elected as fellows to the National Academy of Inventors. I begin with Charles Mistretta, who is Emeritus Professor of Medical Physics, Radiology, and Biomedical Engineering, and a renowned pioneer in medical imaging technology. His research on dual energy X-ray imaging led to the invention of digital subtraction angiography, a widely used imaging tool in radiology. He then developed TRICS, which stands for Time-Resolved Imaging of Contrast Kinetics. And it's a 3-dimensional imaging technique that takes the guesswork out of contrast-enhanced MRI procedures. Dr. Mistretta holds more than 30 patents, 5 of which are currently active, with a number of others still pending. These patents have earned almost $40 million in royalties since 1981. Next, we have Denise Ney. She's the Billings Bascom Professor of Nutritional Sciences and an internationally recognized expert on PKU, a rare inherited disorder that can cause intellectual disabilities. Her research uses a protein found in cheese whey called GMP to develop safer and more palatable medical foods that can treat PKU, as well as having a wide range of other uses for health and wellness. Professor Ney is an advisory board member for D2P, a WARF Accelerator Program participant, and holds 2 US patents, both of which have led to commercial agreements. And finally, Anne Palmenberg. She is the Roland Ruckert Professor in the Department of Biochemistry and the Institute for Molecular Virology. She's an expert on the biology and biochemistry of RNA picornaviruses, the cause of many common colds. Her work solve the structure of the cold virus linked to childhood asthma, which attracted the interest of pharmaceutical companies and sparked new efforts to develop vaccines and antiviral treatments for asthma. Professor Palmenberg holds 2 patents as well as several forms of licensed biological materials. Congratulations to all those 3. They're really remarkable inventors. And now I'm excited to introduce you to the remaining 5 WARF Innovation Award finalists. I'd like to begin by acknowledging the many people involved in selecting these finalists, including my team here. WARF receives more than 350 new invention disclosures each year. Every disclosure is rigorously studied in terms of the patentability and its commercialization potential. Of those inventions that WARF chooses to accept for patenting, our expert team evaluates each one for recognition as a WARF Innovation Award finalist based on 3 criteria. The invention's potential for high long-term impact, whether the invention presents an exciting solution to a known important problem, and whether the invention could produce broad benefits for humankind. We ask a team of judges who have led distinguished careers as leaders in recognizing and advancing innovation to select the 2 winners. We'd like to thank this year's judges for their service. They are Lisa Johnson, CEO of BioForward, Fred Robertson, venture partner, Berg Capital, Sherry Ferrens, she's an expert bonding engineer and a WARF catalyst, Paul Shane, president and CEO of SingleWire and a WARF Catalyst alum, Hari Nair, vice president, corporate ID, Procter & Gamble, visiting scholar, Harvard School of Public Health and a WARF Catalyst. And many of these have served for many years, and we really do appreciate their efforts in serving as judges and all the other things they do to support WARF. Each of the 2 Innovation Award winners that we'll announce shortly will receive $10,000 to split among the inventors. Pretty great. So now let's meet each of the WARF Innovation Award finalists. We've just heard from one, and we'll hear from the next. This first finalist team embodies the kind of cross-disciplinary collaboration that promises to lead to breakthroughs in areas that present some of the most challenging problems confronting society. Let's hear about it first from WARF IP Manager Leah Heyman and Licensing Director Emily Bauer.
Hi, I'm Leah Hammond, an Intellectual Property Manager at WARF.
And I'm Emily Bauer. For this year's WARF Innovation Awards, we're excited to nominate a cross-disciplinary team working to bridge synthetic biology and electronic communication.
Professors Megan McLean and Bhuvna Krishnaswamy are developing next-generation biosensors with applications from healthcare diagnostics to environmental testing to food safety.
Megan and Bhuvna, we are thrilled to recognize your team's ingenuity, and we look forward to your next steps.
My name is Megan McLean, and I'm an assistant professor in the biomedical engineering department. So there's been tremendous progress in the past decades in engineering sensors through synthetic biology and bioengineering to sense a variety of compounds that would be of interest in health in terms of sensing molecules that signal disease or in terms of sensing what's happening in the soil for better agricultural applications. But it's very difficult because cells themselves are not great processors to take that power and hook it to sort of things that would be traditionally useful. Yeah, so at the highest level, the goal of this technology is to allow biological sensing networks to communicate with electronic networks so that each can do what they're best at. So in biology, we have very good sensors for sensing molecules and other compounds of interest, and then we're very good at engineering electrical networks to perform computation and processing. So the idea is to allow them to talk to each other and each to do what they're best at. So on my end, my lab specializes in optogenetics, which we use to control the activity of these biosensors. And so we've engineered a number of optogenetic tools that allow us to control these sensors with light. So optogenetics takes advantage of naturally occurring light-sensitive proteins and then engineers those proteins so that in response to light, they set off reactions or processes inside of a cell.
So my contribution is in leveraging the simplified bioelectronic network that we've developed and address a variety of these communication problems, how to read from these sensors and build a network of sensors to collect most amount of data most reliable data from such a network. We envision this in few years down the line to be incorporated in a wearable system that someone can wear an electronic, a bioelectronic sensor where the sensor is on our body and we turn on it, the sensor with the light and detect some activity on our skin or on our body in real time. So that's where we see this going in the future.
Fantastic. Next, we'll meet a research team whose innovation rests on a classic observation that they've looked at in a fresh way and that has potential applications in fields as disparate as medical imaging and renewable energy. I'll turn it over to my colleagues, Janine Bermania and Stephanie Whitehorse, to set the stage for this discovery.
Hi, I'm Janine Bermania, the Senior Director of IP Management and Licensing at WARF.
And I'm Stephanie Whitehorse, Director of Intellectual Property for the Physical Sciences at Wharf. We are pleased to nominate Professor Kerry Forrest and his team for this year's WARF Innovation Awards.
Their system for generating fusion neutrons could make a significant impact in the production of medical imaging isotopes. It could also play a role in solving the critical challenge of nuclear waste remediation.
Congratulations, Professor Forrest. We are excited to partner with you and your team on this cutting-edge fusion technology.
I'm Kerry Forrest. I'm a professor in the physics department. So in recent years, it's become clear that neutrons are extremely valuable both for industrial purposes and academic purposes. And making neutrons is hard. Normally, we would use nuclear power plants and reactors to produce neutrons, but it would be great if we had smaller, more compact sources that could be moved around and were easier and cheaper to build. So we've invented a technique for making neutrons with small, compact devices using an old idea, which is a magnetic mirror plasma trap to confine the fuel for nuclear fusion that makes neutrons. Yeah, so neutrons are useful for many, many things. Currently in Wisconsin, neutrons are being used to make medical isotopes. There's an isotope of molybdenum 99, which is used in medical imaging. Neutrons are also could be used to burn up nuclear waste from fission reactors. So fission reactors produce waste. If we can make neutrons that have the right energy and enough of them, we could irradiate the waste that comes from nuclear reactors and incinerate it, make it go away so that it can be buried safely without a long-lived effects. We also hope to be able to use the same technology to actually build a nuclear fusion power reactor to make power. We've done the numerical modeling and theoretical modeling to show that it would work on paper. And currently we're building a prototype of the reactor that will be used to demonstrate that the technology actually works.
Terrific. UW-Madison has a long tradition and a global reputation as a leader in understanding cancer and pioneering treatments. Beth Werner and Andy Deteen from Wharf will introduce a collaborative team with another important advance in this critical area of research.
Hi, I'm Beth Werner, Director of Life Science Intellectual Property at Wharf.
And I'm Andy Deteen, Director of Licensing. We're pleased to recognize the cancer immunotherapy work of Drs. Jenny Gumpers and Donna Bayou for this year's WARF Innovation Awards.
By combining two kinds of cells found in the body, Jenny and Donna's work could open up a potentially transformative new approach to immune oncology, one that is faster and more specific than current methods.
Congratulations to your great team, and we're very excited to follow the progress in the days to come.
Hi, my name is Jenny Gumpertz. I'm a professor in the Department of Medical Microbiology and Immunology at UW-Madison. We all know that cancer is a tremendous problem in our society, and in recent years, there's been a lot of excitement about using the immune system to fight cancer. So the current ways that we do that have some problems associated with them, and those have to do with not always activating immune cells specifically enough, or in some cases, it's possible to generate immune cells that we actually grow in the lab and genetically modify and put back into patients to fight their cancers. And that's really very exciting, but the problem is that it takes a long time and a lot of cells, and cancer patients just don't have a lot of time. Our invention involves taking a population of cells that we all have and preparing them ahead of time in the lab. Then we can conjugate those cells. We can join them to another kind of cell that's very specific and specifically activates T cells to kill tumors. These conjugates, these pairs of cells, can be prepared ahead of time and stored so that when patients come in ready for immunotherapy, they can be given these cells without delay. So our current stage is that we're testing our human cells in special animal models where we can create a human cancer in the mice and test our human cells in those models. The next stage will be to move on to doing pilot clinical trials, and that will likely take a few years.
During my career, I worked in the fields of immunology and cell biology, and my research focused mainly on basic research problems. I'm really excited that this research has such a high potential to be translated into a clinical trial in the near future.
Another signature area of expertise at UW-Madison is in stem cell research. Andy Deteen and Victoria Sutton from Wharf introduce a remarkable research team on the cusp of bringing the promise of stem cell technology to reality for a number of game-changing applications.
Hi, I'm Andy Deteen, a director of licensing at Wharf.
And I'm IP Manager Victoria Sutton. For the 2020 WARF Innovation Awards, we're excited to nominate Dr. Randolph Ashton and his team for their work developing improved stem cell-derived models of human neural tissue.
This technology has tremendous potential. It provides a critical step towards bioengineering reproducible spinal cord and brain organoids with applications such as disease modeling, drug development, and regenerative medicine.
Congratulations to Randy and his team. We're pleased to recognize your research in this vital area and look forward to your next steps.
So my name is Randolph Ashton. I am an associate professor of biomedical engineering, and I work over at the Wisconsin Institute for Discovery. I'm also the associate director for the UW-Madison Stem Cell Regenerative Medicine Center. For about a decade now, scientists have been developing methods to culture human stem cells outside the body, and they culture them as a spheroidal aggregate. And when you do that, the cells spontaneously start to differentiate and undergo processes that mimic early human development. And so they can start to create structures that look like what we see in developing human brain, lung, and gut tissues, for example. And so our technology basically allows a very simple method to control this development, particularly for generating models of the brain and spinal cord. And so very early in human development, you form a tube-like structure, which we call the neural tube. And our technology allows us to essentially biomanufacture these neural tube-like structures at will. This will allow us to create models of the human brain and spinal cord that are anatomically similar to what we see in the developing human embryo, and really will allow us to push the technology of creating these types of brain and and spinal cord models in a dish to the next level so that they really closely model what normally forms in the human embryo. And that allows us to be much more precise in the therapies we can develop for the diseases that we can now model with these tissues.
We would hope that this technology gets used broadly. Sometimes techniques like this are thought of as being niche because they're so hard to access, but they have such great utility for generating novel therapies that we think the easier this is to use, the more potential we have to, say, affect human health outcomes in a positive manner.
All right, and last, I'll have my colleagues Brian Froscher and Michael Curie introduce us to a collaborative team who has developed a method for tackling what may be the biggest challenge facing our planet, climate change.
Hi, I'm Brian Freshour, IT Associate at Wharf.
And I'm Licensing Associate Michael Carey. For this year's WARF Innovation Awards, we're thrilled to nominate a team from the Department of Civil and Environmental Engineering.
Inspired by climate change, Professor Bu Wang and Raghavendra Ragapani have developed a process that utilizes industrial waste such as coal ash for carbon capture and sequestration. Their process is greener with lower energy costs than other methods.
Congratulations to your team. We're excited to partner with you as you work to address one of the greatest energy challenges of our time.
Hi, I'm Bu Wang. I'm an assistant professor in the Department of Civil and Environmental Engineering. The problem we try to solve is how to make carbon capture commercially viable. So carbon capture is this process to remove carbon dioxide from air or from an emission stream, such as flue gas from power plants. So it's an important part of the solution to the climate change issue caused by carbon emission. So particularly, if we can remove carbon dioxide from air, we can essentially turn the clock back, so to speak. However, the problem with the current carbon capture technology on the market is they use a lot of energy and therefore are very expensive to operate. So this technology is to capture carbon dioxide from air or from a concentrated emission stream at minimal energy cost.
The technology we are talking about is a multi-step process that involves mineral carbonation step followed by carbon dioxide capture step. In the mineral carbonation step, we actually generate alkaline solution that can scrub carbon dioxide from air or from a point of source from the industry without the need for any pressurization, and hence has very low energy intensity. So the technology, what we are proposing, uses an aqueous solution that is fully recyclable, and it does not need any heat energy input, or it does not need any pressurization required. Hence, the energy costs are low. The impact is mainly in addressing the climate change challenges, and given the significant amounts of alkaline industrial waste that are generated, we believe the technology can be useful for many industries like power plants, steel plants, even using recycled concrete.
So the next step for us is to build a benchtop scale demonstration unit. This will allow us to demonstrate technology, but also optimize our operating parameters. After that, we plan to conduct some preliminary market discovery and research, really figure out what our customers are going to be and our business model.
All right, I always enjoy those videos so much. They're so well done, and really appreciate the inventor community taking the time to communicate the science in that way. It's just, it's really terrific. All right, in addition to the invention we heard about at the start, we've got these 5 projects, and now the moment we've been waiting for. I'm happy to be able to announce 2 teams have won the 2020 WARF Innovation Award. The first goes to Randolph Ashton, Gavin Knight, Benjamin Knudsen, and Nisa Iyer from Biomedical Engineering and the Wisconsin Institute for Discovery for their invention of superior neural tissue models for disease modeling, drug development, and more. It's a terrific group. Congratulations, all of you. The second award goes to Jenny Gumpers and Donna Bayou for medical microbiology and immunology for their invention of a killer combination, multi-cell conjugates for activating antigen-specific T-cell responses. Another terrific group. And thank you. Congratulations to those winners, of course, well-deserved, and to all the finalists. This is just an exceptionally strong group of inventors and inventions, and as you can see, really terrific group of researchers and something the campus can be proud of. You'll find a recording of today's session at WARF's website, warf.org, and there will be news about these inventor groups coming out in inside UW, so look for that. I really want to thank everyone for participating in this. Thank you for joining us to celebrate these innovators, and best wishes for you in the holiday season, and to stay safe and sound. Thank you so much.